once again to the FB live session, and today we have with us Dr. Hari Krishnan, consultant interventional pulmonologist, Apollo Specialty Hospitals, Madurai. And today's session is about chronic obstructive pulmonary disease, abbreviated as COPD. A short introduction about Dr. Hari Krishnan. He finished his MD in tuberculosis and respiratory medicine in Madras Medical College and DNB in pulmonary medicine. Good afternoon, doctor.
Good afternoon to all.
Doctor, what is COPD?
COPD is a chronic obstructive pulmonary disease which mainly affects our human lungs, and it will affect both our airway and the lung parenchyma. And these are two different entities in the COPD, and the first one is chronic bronchitis, and in this the airway will get constriction in result of any insult to the airway. And another one is emphysema, in which the lung alveoli will get distracted, and the oxygen we breathe in through our nose is not able to pass through the alveoli into our blood. So there will be a oxygen deprived state in the body. So these things are the overview of COPD, chronic obstructive pulmonary disease. It contains two components, chronic bronchitis and emphysema.
Doctor, can you tell us what are the symptoms of COPD?
COPD patients usually complains of chronic cough and with sputum production in the particularly in the early morning when we got up from the bed, they can able to produce some thick phlegm out of their lungs. This is the most common symptom of COPD. And apart from that, in severe cases, they will be having breathlessness, and it will be progressive, right? So it will start as a very low level of breathlessness. In initial part, they will have some breathlessness while walking some meters and climbing up the stairs. And as the disease progresses, or we left them untreatable untreated, the patient will increase, that breathlessness will increase, and it will even at rest the patient will be having the breathlessness. These are the most common symptoms of COPDs.
So doctor, please explain us the risk factors of COPD.
So talking about the risk factors and causes, the COPD is almost the man-made disease, right? So due to increase in air population and due to increase in smoking habit, right, the COPD diseases are coming up very highly in general population, and these are the two main causes. And yes, in early 90s, the COPD is only is not even in the top 10 place of world death rates, right? World the diseases which causes the most common death in the COPD is not even in the first 10 in 90s, but now it occupies the third place. This is due to this increase in smoking habits, and the air pollution, and environment is going very bad in coming days. So these are the most common causes. Apart from that, patients in the patients working in the job which risk their lungs, right, like cotton mill industries, and in carpenters, and in any other jobs with increased fumes, like that, in chemical factories, like that. So these are the most common risk factors for COPD development.
Does COPD have stages? If so, what are the stages of COPD?
Yes, we do classify the COPD with the stages according to the severity of airflow obstruction, right? So according to the severity, we can divide the COPD into mild, moderate, severe, and very severe. So there are about 4 stages, and the last 2 stages, the almost patient will be in the respiratory failure. They can't get in the oxygen into their blood. So in early stages, stage 1 and stage 2, there will be a mild cough and there will be a mild breathlessness will be there. So according to the airway obstruction severity, we can classify the COPD diseases.
So doctor, how can be COPD diagnosed?
And COPD is diagnosed with the pulmonary function testing, right? So it is a testing in which the patient is asked to blow through a sensor. So that sensor will recognize the amount and the speed of the airflow from the patient, and will let us know what is the obstruction status of the patient. So this is the most common diagnosing modality of the COPD, and of course the CT chest and chest X-rays can give us some idea regarding whether the patient is having COPD or not.
Doctor, is COPD preventable? If so, how can we do?
Yes, COPD is a preventable disease, of course, since it is completely it is increasing due to our man-made habits. So it is preventable by decreasing the air pollution and quitting the smoking, and also by giving some protective wears to the workers working in the high risk jobs.
Doctor, is COPD completely curable? And please advise us the best treatment options for COPD.
Yes, COPD is not, of course, completely curable. It can be only be controlled with very good medications in inhalational therapy. It is not completely curable, and it is better be prevented than we talking with the curability, right? So we can easily prevent the COPD, and if it came into us, we can easily control the COPD symptoms, and we can make the patient as much as comfortable as they was earlier. So, but when talking about curability, it's almost always not curable.
Doctor, is there any surgical treatment available for COPD?
The inhalational medications or the medical management is the mainstay of treatment, and there are COPD classes in which there will be a patient selection are there for surgical management. So there is a lung volume reduction surgery. It can be done to by even through endoscopically and through that bronchoscopically, and also through open lung volume reduction. So there are a patient criteria, and it is very narrow patient criteria for selecting the patients for lung volume reduction. And right now we are mainly focusing that treat the patients with the medical management. So if the selection criteria matches with the patient, and we do refer the patient for lung volume reduction surgery.
So doctor, what is the life expectancy for a COPD patient?
So regarding life expectancy, it is less than the non-smokers and non-COPD patients, and it can be related with the stages of the COPD. In earlier stages, there will be only a minimal decrease in the life expectancy, but in the 3 and 4 stages, there is a very much reduction in the COPD life expectancy, and which can be tell in the measure of 5 years survival rate, which will be less than only 50%.
And doctor, how can one stay healthy while living with COPD?
So yes, COPD patient is no need to bother, since it is not a curable disease. The COPD patients is almost not no need to worry, because we do have a very good medical treatment and very good inhalers treatment. There are different types of devices available to get the drug into the lungs. So the patient with COPD is I think there is no need to worry regarding the COPD disease. We can very well easily control the COPD symptoms, and also with other supportive measures like pulmonary rehabilitations and good nutritional support, the patient can able to have a near normal life as a non-COPD patients.
What are the complications of living with COPD?
So mainly the complications of COPD is the breathlessness, right? The patient will be breathlessness throughout, and even in the first and second stages, and 3 to 4 stages are very they are affected very severely, and they will be having the dyspnea, and the moving limitations will be there. It is very awkward to them to be in the house because they need oxygen throughout, since the lung is destroyed to transfer the oxygen into their blood, and this is the one thing. And other complications are due to systemic inflammation. They can get the osteoporosis, bone weakness and muscle weakness, etc., through which further their quality of life will be decreased.
And doctor, what are the similarities and differences between asthma and COPD?
And asthma and COPD, we can asthma is a bronchitis in which the bronchitis is due to allergen, right? The patient will be susceptible to some particular allergen like house dust mites, pollen, or like that, and that particular patient will get the episodic and seasonal bronchoconstriction. It is not a permanent one for asthmatic, but in COPD it is a permanent one, right? So these are this is the main thing, and with asthma we can easily reverse that airway constriction to near normal thing, but in COPD we can able to only we can stop the disease progression from a particular bronchitis, but it is not like asthma. It is not possible in COPD to completely reverse the airway diameter.
Doctor, I have some queries from patient. This is from Mr. Ram Kumar. I am struggling with quitting smoking. How can I help me quit, and will it really help me breathe better?
Yes, definitely we can help. Regarding smoking cessation, it is very much easier now, right? There are pharmacological methods also available. There are tablets also available, and the better thing is a nicotine replacement therapy. And the nicotine is a chemical which is available in the cigarette, and that is the one which making human beings to addiction to the cigarette. So what we are doing is make that nicotine in a medical form, right? It is available in chewing gums and in the dermal patches, right? So with this constant nicotine level is in the blood, the patient can decrease their craving to the smoking, and it will help them to coming out of smoking very well.
The second question is from Mrs. Sumati. I was recently diagnosed with severe COPD. How long do I live, and what quality of life can I expect?
Yes, with severe COPD, of course, with the treatments are available with adequate inhalation, and I don't know whether the patient is having oxygen dependent state or not. And if it is there, the patient you should be getting oxygen, the long term oxygen therapy in home is very important to you. And inhalational therapy, please continue the inhalational therapy as prescribed by your pulmonologist. And vaccination is very must to get rid of frequent infections from microbes, and these are the things. And main thing is the pulmonary rehabilitation. Do ask your pulmonologist for a pulmonary rehabilitation program, and get enrolled in that, and make yourself stay as much as wealthier.
Question number 3 from Mr. Shanmugam. I had 2 recent hospitalization because of my COPD. How can I avoid these flares up in the future?
Yes, the most common flare up is due to infections in COPD, and most commonly pneumonia, and another one is a viral infections. And with the adequate vaccination itself, we can the COPD patient can get rid of these frequent exacerbation. And another one thing, you have to get out of the risk factors which caused you the COPD. It may be cigarette smoking. If you are a smoker, get rid of it. And if you are working in a job with the dusty environment, try to abstain from it, or put some protective measures like mask to get rid of the further exposure and further progression of the disease. And please do take adequate inhalers to make you breathe better.
The next one from Mr. Palani. My health is not what it used to be, and COPD is not my only problem. What other diseases are associated with COPD? Will these other conditions impact my overall health?
Yes, there is no particular association. There is no particular association of a COPD and with the other diseases. As I already told, the COPD is the disease which causes systemic inflammation, which can cause your heart weaker, bone weaker, and it will make your muscle weaker. So these are the most common comorbidities with the COPD patients.
The next one is from Mr. Shekhar. My doctor keeps telling me I need to get more exercise, and now she is sending me to pulmonary rehabilitation. How can I exercise when I can't even catch my breath?
Yes, this is the main cause of your disease. It will make you to breathe harder, and to get used to it, and to make your muscle stronger, respiratory muscle stronger, and to make you some more some more even stronger to fight the disease. Only we do advise the pulmonary rehabilitation program with special instrument like with special ergometric instruments. So it is very important, and please do enroll in the pulmonary rehabilitation workshops or program, and it will work. It will help you a lot.
And the final query, doctor, as the air quality is very low in Southeast Asia, for safety, should I be given any kind of vaccination like Pneumovax type without using mask? So is that available?
With the growing air quality issues, yes, the normal general public with some predisposition can develop COPD, and we should use mask for preventive to get protected against COPD. But regarding vaccinations, and right now it is not advisable for general public, right? It is only to aged patients above 60 years, or patients with already diagnosed COPD patients with any age or bronchial asthma can get the vaccination done, and of course in children. So these are the patients we do advise for vaccinations, and vaccination won't prevent you against the COPD. COPD is a different entity. To get rid of COPD, you have to get rid of the bad air.
And finally, doctor, what is your conclusion message for us?
So conclusion message, as I told earlier, that COPD is rising like anything, right? In the 90s it occupies the 13th place, and now it occupies the 3rd place in the most common cause of deaths due to diseases. And so it should be addressed. It should be addressed by every human being in the world, and we have to take care of our environment, and we have to take care of our future generations to get rid of this COPD. And if you are already affected from COPD, there is no need to worry. We have adequate measures to treat you, to make you comfortable, to make you as normal as the non-COPD population. So it is better to prevent it, and if it comes to you, we can able to manage with the very adequate measures available, like inhalational therapies, pulmonary rehabilitation programs, etc.
For appointments with Dr. Harikrishnan, pulmonologist, please reach out at Apollo Specialty Hospital, Madurai. Contact us at 0452 434 1021.
Thank you, Suleman.